Hi, my name is Shannon, and I am from the Department of Occupational Therapy at LSU Health Science Center in New Orleans. In this video, I'm going to review how to best care for your feet. Making these simple changes to your foot care routine can help you to live free from preventable foot care complications. Wearing appropriate footwear is a key component of proper foot care. Whether in home or outside, you should avoid walking barefoot, in socks only, or in thin soled shoes. Do not walk barefoot on hot surfaces such as sand or cement. Do not swim barefoot, as the bottom of pools may be rough, causing scrapes or cuts. Pool shoes or sandals that do not go in between your toes are good options to wear when at the beach or the pool. Wear appropriately fitted shoes. Shoes should be comfortable at the time of purchase. Do not depend on them to stretch. It is best to purchase shoes in the afternoon when your feet tend to be the largest due to swelling. Do not wear shoes that are too tight, too loose, have rough edges, or uneven seams. You should not wear sandals that go in between your toes. No single type or style of shoe is right for everyone. When buying new shoes, first let your foot care specialist check the fit of your shoes before you wear them so that you can return them if they are not right for you. Here are some things to look for when buying shoes. It is safest to wear closed toe shoes because open toe shoes are less protective and can lead to foot injury. It is best to buy shoes with cushioned interiors so they absorb some of the shock when you walk. You should buy shoes that do not pinch your feet or your toes, but not so wide to where your feet are sliding from side to side. It is best to buy shoes that have laces or other closures that allow you to adjust the fit of your shoe. Shoes made of soft leather or other flexible material, which will have some give and stretch as you wear them, are best. The shape of your shoe should match the shape of your foot. There should be about a thumb's width between your longest toe and the end of your shoe, and you should be able to pinch some material at the sides of your shoes. You should always consult your doctor about the best footwear for your feet. Footwear should be wide enough for the foot without putting too much pressure on the skin. If you have had a previous foot ulcer, or if you have a foot deformity such as bunions or claw toes, ask your doctor about getting therapeutic shoes. Never force your feet into shoes that are not the right shape or size for you. It is very important that you never again wear the same shoe that has caused a foot ulcer. Look and feel on the inside of your shoes before you put them on. Check for foreign objects, rough areas, or torn linings. Wear socks and stockings without seams or with the seams inside out. Do not wear mended socks or stockings. Do not wear tight or knee-high socks, and compression stockings should only be worn if prescribed by your doctor. It is important that you change your socks daily because socks provide a protective barrier between your skin and your shoe and may prevent skin breakdown. Wearing white socks can help you spot red or yellow discolorations that may indicate a cut or an infection. Now we're going to review foot care guidelines. You should avoid extreme temperatures. Before bathing or showering, check the water temperature with your hand, elbow, or with a thermometer. Water that is too hot can damage your feet. And remember, if you have decreased sensation in your hands, do not rely on your hands to detect water temperature. It is very important that you wash your feet thoroughly every day. Dry your feet carefully, taking special care to dry in between all of your toes. If your feet are dry, you should moisturize the top and bottom of your feet with a thin coat of lubricating oil or cream. It is important that you do not moisturize in between your toes, as this can cause skin breakdown or fungus. You may want to consult your physician about the best type of lotion to use on your feet. Inspect your feet at least once every day. Good times to inspect your feet are before you put on your socks and shoes, after you take off your socks and shoes, and after you take a bath or a shower. You should thoroughly inspect the entire surface of both feet, including the areas between the toes. Check for blisters, cuts, scratches, reddened areas, swelling, sore spots, calluses, any color changes, dry skin, and infected toenails. The use of a mirror can help you to see the bottoms of your feet. If you have a visual deficit or if you cannot bend over to inspect your feet, have someone assist you in a daily foot inspection. Contact your doctor immediately if you notice an abnormality on your foot, such as a blister, sore, swelling, redness, or if you notice any pain in your feet. Have your feet regularly examined by your doctor. Be sure that your feet, including the areas in between your toes, are examined at each visit. Talk to your doctor about how often you should receive a professional foot examination. If you have thickened skin on your feet, such as calluses or corns, you should talk to your doctor about how to remove them. Do not do bathroom surgery yourself. It is very important that you do not use chemical agents, plasters, corn or callus removers, blades, or callus files to remove them, as this can cause a serious infection. You should check with your doctor first before cutting your toenails. Toenails should always be cut straight across, and it can be helpful to use a toenail filer often to reduce the frequency of needing to cut your toenails. Other do nots. Do not soak your feet unless specifically instructed to by your physician. Soaking your feet can cause dryness and infections. Do not use any kind of heater to warm your feet. Do not warm your feet using a hot water bottle, electric blanket, heating pad, or a campfire. If your feet feel cold, simply wear socks. You should take special precautions in cold temperatures. Wear wool socks and protective footgear, such as fleece-lined boots, and carefully check your feet for frostbite. These foot care guidelines can be a bit overwhelming, so let's review. These are things that you should be doing. You should wear appropriately fitted shoes, inspect your shoes before putting them on, wear socks and stockings without seams, avoid extreme temperatures, wash your feet thoroughly every day, dry your feet carefully, taking special care to dry in between all of your toes. It is very important that the area between your toes stays completely dry. You should moisturize the top and bottom of your feet. Inspect your feet every day. Contact your doctor immediately if you notice an abnormality on your foot. Have your feet examined regularly by your doctor and have your toenails cut straight across. These are things that you should not be doing. You should not walk or swim barefoot. You should not walk in socks only. You should not wear thin-soled shoes. You should not wear sandals that go in between your toes. Do not wear shoes that are too tight, too loose, have rough edges, or uneven seams. Do not wear the same shoe that has caused an ulcer. Do not wear knee-high socks or compression stockings. Do not moisturize in between your toes. Do not do bathroom surgery, such as using chemical agents, plasters, corn or callus removers, blades, or callus files. Do not soak your feet. And do not use any kind of heater to warm your feet. While these foot care guidelines can seem overwhelming, it is important that you take them seriously because making these new habits can save you from having a serious foot complication such as an amputation. Thank you for taking the time to watch this video. I hope it has given you a better understanding of how to best care for your feet.